What kind of fibers might these be right here? Those are pressure sensors. That's where your body monitors the blood pressure. Okay? So the place that our body measures our blood pressure is right here in our carotid arteries. Now, why would that be important? Well, what's the most important organ?
Brain.
The brain. And so you need to have the right blood pressure here to know you're getting enough blood to your brain. And that's one of the things that the glossopharyngeal nerve does, is it sends these signals up to the medulla to carry blood pressure signals up there. It also works all of these little muscles in the back of your throat, which you don't even need to know the names of. It basically does not go to the main tongue muscles. That's an important point. Even though it's called glossopharyngeal, and you'd think, oh, glosso, it's tongue. It doesn't really go to the main muscles of the tongue. We'll get to that in just a second. It also goes to these spit glands, the parotids, there's 3 sets of salivary glands. We'll talk about them later too. Vagus nerve number 10. It's a mixed nerve. It's widely distributed. It truly is the vagabond nerve. That's where it gets its name. It does some sensation in the back of the throat. Some sensation of the diaphragm. That seems weird, doesn't it? Why would the vagus nerve control your diaphragm?
It's your fight or flight.
Helps you breathe, doesn't it? It's mostly just sensation in here, though, and it's telling you, it's letting you feel your diaphragm. We don't really feel it much, so we don't think about it much, but it does carry sensation from the diaphragm. It keeps you from breathing in too much and stretching your diaphragm, for example. Motor, it carries some motor fibers from the medulla. Goes out through the jugular foramen. That's probably one you might know, because the vagus nerve goes down with the jugular vein all the way to the heart. I think that's really enough. The main thing is, as I said earlier, the vagus nerve is vagabond. It goes all through the abdomen, and it goes through your digestive, respiratory, and cardiovascular systems. How many of you guys have ever felt really nauseated sometimes, and then all of a sudden you get really bad diarrhea? You know, you got to run to the toilet, you know? Well, that's one of the things that your vagus nerve does for you. It carries those signals to your digestive system. It makes your stomach secrete more acid. For example, if you're walking into a really nice restaurant and you smell all these wonderful foods and you know in your brain that you're getting ready to eat and you're thinking, man, this is going to be great. Well, your stomach starts right then making more acid because it knows there's food coming. So that's one of the signals that's carried down by the vagus nerve. In surgery, we used to do what's called a vagotomy. We'd go in and cut the vagus nerves. And the reason we did that was so that you wouldn't make more acid, and so you wouldn't get a peptic ulcer, because that was a huge problem back before the days of things like Zantac and all those wonderful Tagamet and all those wonderful medicines that just make your stomach stop making acid. Such wonderful drugs. Took one myself last night. You ever get a little heartburn, just, buy them for 3 cents a pill at Costco. Anyway, so here's the vagus nerve. And as I said, the vagus nerve goes to some of these little muscles back here in the back of your throat, but mainly it's sending all these things on down to the rest of your body. It also sends innervation into some of the muscles that have to do with your speaking, control of your voice. Here's a lower picture of the vagus nerve. Notice that it sends branches to the heart, cardiac branches. It sends messages down here to all the intestines, all the guts down here, and also to the lungs. Obviously, it's one of the reasons that kids get asthma. It sends so many messages to the lung. It tells them to control their, tighten down their muscles in their bronchioles, and gives them an asthma attack. Okay, number 11, we're almost done here, is the accessory nerve or the spinal accessory. It goes to these muscles right here. Has a little bit that goes up front to some of the muscles up in front. It also goes to the sternocleidomastoid, remember this guy right here, and the trapezius muscle, the big triangular, the trap on your back that you know, Arnold Schwarzenegger has this huge trap back here that juts out on both sides and makes him look like he has no neck. That's the trapezius muscle doing that. And the last one is the 12th nerve. The 12th nerve is the one that makes your tongue move. Okay, it is, you see, it is a motor. Yeah, it's just purely motor. I should write that. I should rewrite that for you. Okay. So it makes your tongue move. It does all of these things for you. And the thing that you should know is this. If the doctor said to me, stick your tongue out, and my tongue went way over to one side, what's the problem? One side is paralyzed. Which side is the one that's paralyzed? Is it the one the tongue points to? Or is it the one on the other side?
The other side.
No, the other side is just fine. The other side is fine because what you're doing is you're pulling your tongue out. So the other side is strong and it pulls the tongue out. But because this side can't pull its side out, this side is paralyzed, it goes and points to that side. The way we all used to remember that is the tongue always points to the side of the problem, which is kind of different than a lot of things. But if you think about it, it's just because the muscles are being used to pull your tongue out. Gee, I never thought about that. Here's the 12th nerve. You see that it goes to a number of muscles back in here, a bunch of the neck muscles, and so forth. This diagram here has both 11 and 12 on it. Here's the accessory nerve, number 11, also called the spinal accessory nerve. And you notice that it's going to the sternocleido, the trap back in back, the trapezius, and so forth. The hypoglossal nerve, the 12th nerve, comes in through here. It goes to a bunch of these small muscles, but mainly it goes to the intrinsic muscles of the tongue, the ones that make your tongue work. And you've probably seen people that have had a stroke that can't talk really good because their tongue doesn't work right. And that's obviously they've had a stroke in the area of their 12th nerve in the brain. Let's talk for just a second and then we'll get out of here. Cranial reflexes, because I think if you can learn your cranial nerves, but if you don't figure out how they get used, they don't help you that much. So let's just do, based on the notes you just took and so forth, let's talk about a couple of reflexes. Let's start with the first one with the pupillary light. You take a light, you shine it in their eye. What should happen to their pupil? It should shrink, right? Keep too much light out. What nerves does it take to make that happen? Oculomotor. What does the oculomotor go to? It goes to those pupillary muscles. Those are one of the intrinsic muscles that comes through the oculomotor, number 3. But what starts it? What cranial nerve interprets the light? the optic nerve. Number 2. So so that's a reflex that involves afferently. The signal is from the optic nerve, goes back to the brain, and then it sends the message back out through the oculomotor to make the lens close down a little bit. Not the lens, but the pupil. Let's talk about the corneal reflex. Corneal reflex. That's where doctor maybe had never done this one to you, but take a little bit of cotton swab and make a little point on it, and you have the patient look over that direction, and then you come out here and you touch their cornea, the white part of their eye, out here on the side. Doesn't really feel good, and normal reflex would be to go, right? So what are the afferent and what are the efferent fibers that make that happen? What cranial nerve brings back sensation from your eye as well as the rest of your face? Trigeminal, that's right. So the trigeminal is the afferent limb of the corneal reflex. Now what nerve carries the information back to make you close your eye? Excuse me? Facial nerve, right. Number 7. Makes you close your eye. Orbicularis oculi. Got it? There's a couple more here that auditory reflex. We do this to kids a lot because you can't ask them how well they can hear out of one ear or the other, but you come up and you clap your hand by one ear, and what do? Generally, they will move their head towards the sound and they'll look. So that means they had to hear the sound, all right? And then they had to send the message back to the muscles of their neck and so forth to make that all happen. And you can see there's a bunch of nerves that make that. 4, 6, 3, 4, and 6 are moving your eye muscles, right? Those are the 3 eye muscle nerves. And then there's 7 and 10 that are causing you to move the muscles to move your neck. So that's a pretty complex one. What's the consensual light reflex? Consensual means, I'll agree to do that. And being consensual. Well, it means if you shine the light in the right eye, that the left eye will also contract on the other side. All right, let's quit there before these people come in here in their chemistry madness and want to come and get us. That's the end of that chapter, folks. In 3 lectures, we're done with chapter 14.